Hi, my name is Rob Gordon. UC San Diego Health, an organization that is in theory my medical health provider, has started some kind of advertising campaign to promote its psychiatric services. I have lots of questions about it, but first let's watch the video. It's only about 1 minute long.
Hi, I'm Dr. Andres Schneeberger, a psychiatrist at UC San Diego Health. Behavioral and mental health conditions affect nearly 50 million people in the United States, yet they're not discussed nearly enough.
Really, Dr. Schneeberger? Not discussed enough? I think they're discussed all the time. The issue is not more one-sided discussions. It's identifying the problem or problems, finding the best and most effective solutions, and most of all, and I can't emphasize this enough, especially for UC Health, making sure you're not making any false assumptions. But at any rate, go ahead and proceed.
UC San Diego Health offers programs not available elsewhere for all types of mental health conditions, such as eating disorders, substance use disorders, first episode psychosis, and more. We are also one of the largest providers in the region to offer TMS for adults with depression that is hard to treat.
TMS. Are people supposed to know what TMS stands for? When you do any kind of public communication, you should always define your acronyms and any special kind of jargon you're using. TMS stands for transcranial magnetic stimulation. It uses magnetic fields to stimulate nerve cells in the brain to treat depression. And there's some evidence that it works, but it's not real strong evidence. It's colossally expensive. The machines, I'm told, typically cost over $100,000, requires as many as 30 sessions over a course of 6 weeks or so. So it's a significant investment in time for people, for anyone who wants that kind of treatment. So a session will cost in the ballpark of $500, and then, so therefore the cost would be more than $10,000 at least. Insurance companies, including Medicare, might cover the cost, but they don't like it. So the out-of-pocket expenses can be huge. UC San Diego is hardly the only psychiatric business promoting this. In fact, TMS treatment centers are sprouting all over the place. One is right here in my neighborhood. So it's completely fair to ask, do providers like UC San Diego Health Psychiatric Department really believe it's effective, or are you just doing it as another funding source?
We have locations across San Diego, including our newest location at East Campus Medical Center. Mental health disorders are as real and treatable as any other medical issue.
That's partly true. I, for example, had a highly effective treatment for ADHD, but there are some important differences. First, mental health issues generally have some connection to your life situation that the psychiatric profession is completely incapable of addressing. It is seldom 100% organic. Second, the stigma of mental illness is very real. I didn't believe it myself at first, but I can tell you what I've learned. The stigma of mental illness does not come from society. The rest of society has either been indifferent or even somewhat supportive to my ADHD when I came out with it. The stigma comes from the mental health professions themselves and from the legal and political system. There is a risk in asking for mental health help, a huge risk actually, and you're doing a disservice to the community by not disclosing that.
If you're struggling, know that help is out there.
Dr. Schneeberger, that's just not true. Help is not out there. In fact, help is not even available at your own organization, so I don't know why you'd say something like that. I was in a crisis when I went to your organization. I was and still am traumatized by the criminalization of my successful mental health treatment program by a profoundly dishonest man in your profession. He wasn't my psychiatrist. I'd never even met him in person, but he did enormous damage to my life. I didn't know it at the time, but that man is unfortunately also a professor in your organization. I had heard that UC Health has good services, and since I've lived my whole life in the shadow of your institution, I thought I'd give it a try. I didn't know it at the time, but to get help at UC San Diego Health Psychiatry Department, you have to have a primary health physician there make the referral for you. So I had to jump through that hoop just to get started. Then I learned your waiting list to get help is more than 3 months long. That's atrocious. My primary care physician gave me that referral, and she said stat on it, which I'm sure you know in the medical profession means urgent. And with that, she was only to get it down to about 2 months, 60 days. That's simply an unacceptably long time for someone who's in a crisis to have to wait for help. When I was finally able to get in there, I had a horrible meeting with a man who unfortunately was also very dishonest. He didn't lie to my face, but he did lie extensively on my medical records. I had to deal with that. He did it numerous times, and it seems to be almost an accepted way of doing business in your profession. That psychiatrist specialized in gay and transgender issues and in substance abuse. And even if he had been honest, that was not a very good match for me. But since I was just looking for medication management, I decided to just live with it. Unfortunately, he made it clear that I was considered to be a drug abuse suspect. And while he didn't say it to my face in the meeting, in my medical records, he made it clear I'd be subjected to your forced urine testing program, which I believe is known as the university's zero tolerance program, and that I would be urine tested. I'm 70 years old now, and in my worst visions of what my future could have been, I never thought that I would go to a doctor and ask for help and to be considered a drug abuse suspect and to be ordered to urinate, to be forced to urinate. And I find that extremely distasteful, to put it as mildly as I possibly can. I'm still, in theory, a patient of UC San Diego Health, so I accept that I'm subjected to your zero tolerance urine testing program. To do otherwise, I may be suspected of being a drug abuser, as two people in your organization have already complained, even though it has no basis in reality. I'm not. Since I don't know what you guys say to each other privately, either to each other or to government agencies you work with, I think it's important that I do make that offer. I call this a sick kind of McCarthyism. Since you're from another country or people watching the video might not be familiar with that term, it's a really unfortunate chapter in American history where someone could just accuse you of being a communist and essentially ruin your career. Just the accusation was all they needed. Psychiatry has way too much power now, and they're getting more, and it's almost unbelievable what's going on right now with the psychiatric profession. So I know that in your world, if you refuse a urine test, there's a good possibility you'll be considered a drug addict, and I am not. I do have some conditions this time. You'll need to pay the full cost of my time for the urine testing, including my transportation time. That should probably be at your rate, not mine. My rate's not real good these days. And whoever orders that urine testing program, or whoever's involved with the forced urine testing programs there, should also take the urine test, and they should want to prove how clean and pristine their urine is. And those results should be made public, and so that we can discuss it publicly. You won't find anything in mine. You may find some nicotine, but you're not going to find illegal drugs or even legal ones like cannabis. I don't do that, so you're not going to find it. I think you should have also disclosed this in your video, that by asking for help, you may be considered to be a drug abuse suspect and classified as one on official records that are very difficult, maybe impossible to ever get rid of. I can talk extensively about that. I think you call them a substance user. It's called a substance user, and you can be accused even if you're not one. I just called your department to verify the waiting time in case I had just been unlucky the first time I looked into it. And I verified that it's still almost exactly 3 months. This is the 20th, 3 months from now on the 20th. 3 full months. So if you're in crisis, somebody's in crisis, that's how long they have to wait to get help. And you're essentially, so for all practical purposes, you're promoting a service that doesn't even exist. I've come to believe there's no sin worse than wasting someone's time. And in the case of UC San Diego Health, you're doing it to the people who can least afford it, financially or emotionally, and you're wasting a lot of their time. It's become almost a cliche to say, my doctor or health provider is wasting time. It just doesn't convey how serious it is. So I'm now calling it what it is. It's time theft. You don't waste people's time, you leverage their time. You steal it. And that has to stop. The psychiatrist I saw there took a huge amount of offense and a metaphor I used, cutting down trees in the rainforest. I was interested in economic development before being criminalized, and one tenet of economic development is to try to find the true cost of any enterprise. So in the case of someone who cuts down a tree in the rainforest, they may take it away and sell it and make a bunch of money from selling the hardwood, but they didn't they didn't account for the true cost to the rainforest, the ecosystem, and the planet. Essentially, that's kind of stealing. And in a way, I do think that is what you're doing there. Help is not out there. It's not available in the region, and it's especially not available at your organization. What if some desperate person believed you and tried to get help at your organization, but became distraught, committed suicide, or overdosed on drugs during that month-long waiting period? While you won't agree, your organization has a failed delivery platform for mental health services, and it's dishonest to say otherwise. I shudder to think of what you must be saying to government funding agencies. Essentially, you might be saying something like, look, our delivery platform has failed. Look at all the people we aren't helping. So give us more money so we can do the exact same thing and keep failing in the exact same way. True mental illness is doing the same thing and expecting different results. Your psychology department is also pretty horrible, but in a different way. Apparently they have some kind of one-size-fits-all plan. I don't even know that much about it. Once I bombed out with your psychiatry department, I just didn't. How can you get help from when your main problem is the system that caused it? But I think you have like a 6-week limit, and I mean, don't quote me on that. I mean, you would know. But it's like everybody gets the same thing. You have to respect the sanctity of the individual. And something is wrong there. I have been able to get some help through a group I started for adults with ADHD. I started a group, social and support group for adults with ADHD, grew to about 40 members, then took over a much larger group, grew it by another 200 members, and now it has 600 members and growing. And we have a real-world meeting every month, and an online meeting also every month, and alternating weeks. So there's 2 weeks between each meeting. One of the conditions or disorders, I think you guys call them, that was fabricated for me, and it's probably the least serious of all the ones that were fabricated, but the most offensive, is the professor says that I have a history of antisocial beliefs and attitudes. The whole history. This is a person I met once for 10 minutes. And it wasn't even a consensual, what's the word? Not consensual, consensual, patient consent. I didn't consent to the meeting. In fact, I wrote a letter before saying this was not a session, but it didn't matter. They go ahead and charge the government. That 10-minute meeting was charged, I think, 15 minutes. Billing fraud, they don't even care that. But I have a whole history of antisocial beliefs and attitudes. And I consider myself to be a community organizer. Maybe not a very good one, but I do try. I've organized social groups for my neighborhood in Pacific Beach, or I did before the pandemic. I had an organization for small businesses. It was originally called Beach Area Self-Employed, and I expanded it to a regional group, San Diego Independent Business Professionals. We were doing pretty well before the pandemic. If I get this stuff out of my way, I might like to get back to that as well. Dr. Schneeberger, if you want to reclaim your integrity, have this video removed. It's not doing you any good. It's not doing your organization any good. And it's not doing the community any good. And it could be causing a lot of damage. It's misleading. It's deceiving people. We don't live in a perfect society. And we certainly don't have perfect organizations. But there's a way to be honorable, even within imperfect organizations. And the way you do that is to become what Americans sometimes call being a straight shooter. The metaphor straight shooter basically just means be honest and direct. And that means admitting to the flaws in your own organization and not doing the exact opposite of what you did in this video, frankly. Those are people who are admired. When they tell you the way things really are, they don't waste your time. They say, They give you other ideas, like, this is not a good place for you. Why don't you check out this? Those are the kind of people who have integrity and honor in a flawed system. I would strive for that. Your first step, I believe, is in having this video taken down. Don't accept it. Don't cooperate with evil. Earlier in this video, I gave a misquote of a misquote by Einstein, supposedly by Einstein. Insanity is doing the same thing and expecting different results. He never said that. He never said a lot of things we attribute to him. Another thing he didn't say that I like even more, it's a mistranslation at best. Probably didn't say, sort of close to it, but I do like it. So I'll leave this video this way. A quote attributed to Einstein, we'll put it that way. The world will not be destroyed by those who do evil, by those who watch them and do nothing. Thank you for listening. Thank you for your time, and thank you for your attention.